That exercise training improves well-being and reduces asthma symptoms, we already know. However, the effect of physical activity on improving sleep quality remains unknown. Asthma is a heterogeneous chronic inflammatory disease of the airways and characterized by respiratory symptoms such as wheezing, dyspnea, chest tightness, and cough. Individuals with asthma are more likely to develop sleep-disordered breathing and being physically inactive. The fear of inducing shortness of breath or triggering exercise-induced bronchospasm inhibits many individuals from participating in regular physical activity. What if we change and revert this scenario and improve physical activity in this population? What would be the effect on sleep quality? Therefore, we evaluated the effect of a 8 weeks behavioral intervention to increase physical activity and daily living on sleep quality in adults with asthma. In addition to sleep quality, physical activity and daily living level, asthma control, health-related quality of life, and anxiety and depression levels were assessed before and after the study in both groups. 49 participants were recruited and randomly assigned to either the control or intervention groups. Were evaluated sleep quality by actigraphy and Pittsburgh Sleep Quality Index, physical activity and daily living by accelerometry, and asthma control, health-related quality of life and changes in anxiety and depression symptoms by questionnaires. After an educational program, only the IG was submitted to a behavioral intervention program in 8 face-to-face, 40-minute sessions each per week, with one theme per each. Meanwhile, the CG received the usual care. After the intervention period, IG showed a significant reduction in sleep latency and an improvement in the efficiency compared to the CG, reaching normal sleep efficiency threshold, 85%. 50% of patients in the IG improved sleep quality after intervention compared to CG. Before the study, participants were classified as physically inactive, 47%, or low active, 53%. After the intervention, 56% in the IG and 4% in the CG were reclassified as physically active. Before the study, participants in both groups had 1.2 plus or minus 2.1 days without asthma symptoms. After the intervention, participants in the IG showed an increase in the number of days without symptoms compared to those in the CG and a reduction in every asthma symptom. At baseline, patients in both groups reported similar quality of life. After the intervention, no between-group differences were observed in the total AQLQ score, p equals 0.33. However, patients in the IG reached a clinically relevant improvement in quality of life. Before the study, the proportion of participants with anxiety and depression symptoms was similar between the groups. After the intervention, more participants in the IG reported an improvement in anxiety symptoms compared to the CG. Changes in sleep efficiency were positively associated with changes in daily step counts and negatively associated with anxiety symptoms. Most participants who walked more in the IG improved sleep efficiency and reduced anxiety symptoms. In the end, the present study demonstrates that a behavioral intervention improved the physical activity level, quality and efficiency of sleep, and symptoms of asthma and anxiety.